Welcome everybody to this week's call, Dr. Joseph Ahrens, Health Talk 365. I am going to apologise on his behalf. He is travelling to Australia as we speak, so he's coming to good old Aussie land. And today's topic, what we're talking about is we're just talking about the basics of Emulin, but we're going to take a different route in regards to talking about the flavonoids themselves and the presentation so that we can look at how can we present this to people in regards to what are these flavonoids, like what is this mixture of flavonoids and why is it so special for people. So I'll get started straight away into it. I've got a huge passion in this space, as a lot of others do as well. Just got to find it where I hid it. Let me just have a little look, because like Dr. Ron Bosima and myself, we've both been in this space with this particular product for, I think, nearly six plus years now, I believe. And it's just, for what I have seen, for what I have experienced myself in all of those things, it just has become the missing link to my health. And I've just found that I've seen a lot of people's lives change as well. So I'm just going to do a bit of housework. Todd, can you keep an eye on people and just let them in for me when you can? So when we talk about flavonoids and we all know what we have. And if we start looking at, well, what does that look like? It is the missing link in health. I really, truly believe that we are what we eat. But we need to understand what are flavonoids and why are they essential for everybody. What is a flavonoid? And what's the flavonoid formula made from, and what is the link in today's nutrition specifically, so we can share with people that let's talk about flavonoids, let them understand why is this particular formula so important. So each time when you talk to people about it, ask them these things first, because you want to try and set up why they need them and why they're so important and why the power behind these products are. From Dr. Joseph Ahrens, who's a dual-nominated Nobel Prize scientist. So I want to say that because you're not going to see this in this presentation, and why 15 years of research has become so imperative for us to be able to share with good faith, knowing that there is a published paper in PubMed on this, a medical paper, and there have been double-blinded clinical studies, human clinical studies done on this formula as well. That it's not something that's just been put together. It's years of research that has been put together and has been acknowledged by Dr. Ahrens' peers as well. So I want you to think about, how you feel right now, and let's consider what a difference your lifestyle choices can make when your health is actually being compromised. So health, wealth, and happiness means a lot to many people. Health to me means, do you want to feel better? And imagine being able to wake up and actually enjoying life and doing what you want to do. And the wealth of being rich in health. And there's no way that you can actually create. I had a huge mentor, an owner of a company a few years ago, and he said, we want to have good health and we all want to create wealth. And wealth in the money in the bank, we need money in the bank, but we can't do that without having good health. And of course, if we don't have or health or wealth, how can you be happy? So these are all things that we start looking at, that health, wealth, and happiness. Bad health costs a lot of money. So if we can try and invest time in your health before it invests all of your time, it is an investment in you. So ask yourself and ask people when you present this to people, how long have they been suffering with what their conditions are? Because these flavonoids, I guarantee you, they're going to make an impact on your life. But what I can't tell you is how long it's going to take or what sort of an impact it's going to have on your symptoms that you have. But I do guarantee you it's going to make a difference in your life. It just depends on the timing, because when we start working at a cellular level, it starts to be something that start analyzing it in 3 months. So we look at blood cycles. If you go to your physician or your doctor and they'll say, come back in 3 months and do another blood test. Why? Because your blood cycle is a 3-monthly turnover period for what your heart's turning over and cleaning blood out. So, for me personally, so I can speak hand on heart with this, when I started with these flavonoids, with this formula, I was feeling pretty darn glim. In 3 months, I hugely noticed a massive difference. 6 months, 9 months, 12 months, I was sitting on cloud nine. I've got to honestly tell you, it was just a huge, big, a transformation for me with my health. Was I fixed? No, I wasn't. But I will say this to you, that people do feel a huge difference, and they will feel different within weeks. I personally felt a difference within about 2. And there were certain aspects as we go through here that I'll share with you. So tell people to give it at least 30 days, but I ask people to please give it 3 months. But 30 days, they should notice a huge difference. But there are going to be certain things that they're going to notice within days, week, week, 2 weeks, is that mental clarity. And why? I'll explain that as we get going through. And seeing life with a clear focus minus any fog. That was one of the things that a lot of people do notice straight up. And it's the controlling of the sugars that you're looking at, where this product has the ability to cross that blood-brain barrier. So when we get a lot of excess sugars that are sitting up in the brain, we start getting all of the issues and the symptoms that come with that. So, one of the steps going forward for us is understanding what are carbohydrates and what are sugars. And it was interesting, again, and we learned by people around us and how people tell us. I didn't know that. My parents, I spoke about them on a call earlier. My mother's 81 and my father's 86. And my mother was having rice. And I said to her, I wish you wouldn't do that. And I said, it's just loaded with sugar. And as you will see as we go forward, I explained this to her. What is the problem? Why do our bodies develop inflammation? When we start looking at a little bowl of rice, and this little bowl of rice is what you would see when you go to, whether it be a Chinese restaurant or a Thai restaurant, that little bowl of rice, you're looking at a large volume of sugar. And when we start looking at it, carbohydrates metabolize into simple sugars and raise your blood sugar level, causing inflammation. And so if we look at type 1 diabetes, type 2, gestational diabetes, and so forth, sugar fuels that. And this is where I want you to understand that rice has no nutritional benefit except when it's being used as energy source. So if you're an athlete, and there's different types of rice that are better for you, but if you're an athlete and you're going to be burning it up, then small quantities of it are going to be beneficial for you. But if you're not, then it's something that you start looking at that as a refined sugar. It's a toxin, it's an addictive drug, it's a poison. And it was never meant to be stored in our bodies. So if we go back to what Dr. Ahrens has spoken about quite a lot over the years, go back to the caveman era with the hunter and gatherers. We were on the move all the time. We didn't have remote controls. We didn't have Siri do this, Alexa do that. We actually were up and mobile. Whereas people are more sedentary, not just in lifestyle, but in their jobs as well. So if we start looking at, I put the additional pound per year for 2020. That was the last one that I could find. So you can see that it's dramatically changed in the amount of consumption that we're having. And why? We've got a lot of processed foods. We've got shelf life foods that we're actually buying. Because it's convenient, it's cheaper, but a lot of them are loaded with sugar. So if we start looking at the deadly cycle of sugar, and I think that when we start looking at it, think about when you eat sugar and you're craving something. If you're not eating and grazing throughout the day, you're going to find that what's going to happen with you is that you're going to get a sugar spike. Like you're going to get headachy, you're going to get low on energy, so you're going to crave something and your body's going to drive you towards something that's sugary because it wants to pick up your metabolism as quickly as it can and your sugar levels. But you're going to eat sugar. You're going to get a blood spike through your sugar. So you get that dopamine release, you get a massive, pickup, but it just as quickly as it goes up, it drops just as rapidly. So then what happens is your blood sugar levels continue to drop. The high insulin levels cause fat storage. Your body craves the lost sugar, that sugar high. And then we come back down to where we're hungry and we're craving again. And it's that continual deadly cycle is what you're going to experience. And this is where understanding with carbohydrates, and this is what I was saying to my mum the other day, they are individual units of sugar. And she's just going, are you kidding me? And I'm going, no, I'm not. So if we start looking at excess carbs, that leads to carb toxicity and increased blood sugar, elevated blood fats, excessive weight gain. These are just some of the things that it can create for you in regards to having a prolonged excess carbs is a root cause of most diseases. So I want you to note, I think, when we start looking at what does this message tell you, refined carbohydrates and sugars fuel inflammation. So we want to be able to try and intervene there and support the body, assist it to be able to manage the symptoms of inflammation. Flavonoids regulate the immune system to support inflammatory levels within the body. So our formula that we have is doing this for you on a daily basis. I want you to think about this unhappy little man. That can you relate to any of these? Maybe somebody that you know, because there's an awful lot of conditions around this little man, and they all lead to one thing. And most people, as we go through life, they'll have one of these things, but they'll probably have multiple things, because most people are going to have an injury, they'll have an infection. You may have people that have got a skin condition, whether it be something to do with their respiratory system internally, whether it be bowel, whatever it may be. Inflammation is going to be part of the driving force to fuel that. So if we start again looking at inflammation in all of these conditions, you're going to see in the next slide, you're going to notice the roots of the trees are relying on our nutritional choices. What does that mean? What we're fueling our body with, and the roots being the internal system of our body. That deficiencies within can develop inflammatory conditions. So what do I mean? It means that what you're doing is you're basically fueling those conditions. So by the time that you're seeing what's happening on the outside of the tree, you've already got a condition. But what we want to see is underneath. So what happens inside, you can't see what's happening inside your body. You may feel some disease, but generally you're going to be diagnosed with something on the surface, and then you really start to understand what's happening underneath in the roots. So we want to be able to fuel the roots. And that's internally by what you're fueling your body with, because inflammation is the first step of the immune system response to infection, irritation, or injury. So we do need inflammation. Short term is where it's going to help the body to heal itself. It's the long-term chronic inflammation that we're trying to support, because that's the one that hangs around for a long time, that has an attachment to chronic conditions, and some of them can be life-threatening, like heart disease, diabetes, cancer, and more. And the excessive consumption of refined carbohydrates can lead to inflammation. So we can see by talking about these flavonoids, you can understand that the missing link to nutrition. And of course, we've got other areas there too of the enzymes as well that make a huge difference to us too. So we've got quite a few things there where we can touch base on. So in health, in short, when we start looking at diseases themselves, that most of them, nearly 85 to 95% of these health conditions are inflammation based. So this is where we start looking at this product of being able to support the root causes of them, because there is currently no other product on the market like this that is a natural based product. So it's not a synthetic product. And what does a synthetic product mean? A synthetic product is where it's something that has been chemically developed, and then therefore your liver is going to have to process. It's putting your liver under more duress than necessary, as opposed to these flavonoids are being absorbed through your natural body, through your skin, through your blood system, through your gut, etc., and so forth. So natural changes will occur for you. And what is part of the problem? Well, our food basically lacks the nutrients that we need. So if we go back in our grandparents' era, a lot of food was grown in the ground, in our backyards. They grew their own food. But what's changed is that we're buying a lot of our food, and even though they can say that it may be better for it, it could be organic, but even still the soil itself that the food is being grown in has changed. Our actual soil itself on our earth has changed. So again, flavonoid deficiency syndrome, it's a lack of flavonoids in the diet. It results in dysfunctional carbohydrate metabolism and chronic inflammation and disease. Flavonoids put back what has been taken out of our original diets. They're found in fruit and vegetables. They replace what is missing in our diet. And flavonoid deficiency syndrome results in low energy, and eating more carbohydrates only makes it worse. So this is where we can get the support through this product. But I do want to say that we're not trying to aim to cure, heal, or treat any diseases here. This is just spotlighting or putting a spotlight on what these flavonoids are, but we want to understand who, what, and how, and what is the missing link of nutrition for it. So who can actually have these products? Well, basically everybody. Now, one of the very first flavonoids in here is a chlorogenic acid, and it comes from the green coffee bean. Over the years, what I have noticed, and I'm sure that some others have too, if you've been on this journey for as long as we have, you know, one of the things that we had was people would say, I'm allergic to coffee beans. Well, you've got to understand this is coming from an extract of a natural product. So it's not like what we're having with our coffee when you put it into your cup of coffee in the morning. It's an extract. It's a clean extract that's been carefully formulated by years of research and science. And what does this particular flavonoid bring to the table? It's a powerful antioxidant, improves your blood circulation, your immune system support, helps in your weight management. It's not a weight loss product, but it's going to help in weight management because it helps with refined carbohydrates and also controlling sugars. Improves your metabolism, regulates your blood sugar, and boosts your energy, and a detoxifier. So that's just the first flavonoid. The second one is myristicin, and it comes from the grapes. It also reduces inflammation and promotes a healthy heart, healthy skin, lowers cholesterol, vein elasticity. It actually helps with the damaging effects of the UV and the sun, that we're all out in the sun, a lot of us, so it can support you in that area as well, promotes a healthy brain and improves your blood circulation as well. And this is the big one with this particular formula, and this is a difference between you really understanding what are the difference between the two different formulas and these two different flavonoid formulas that we know is the quercetin percentages. So in one particular one, there are lower percentages in the quercetin, but they both do the same. So it's going to reduce inflammation again, heart and blood vessel support, fights arthritis and chronic fatigue, allergies and infection assistance, and improves the immune system. So you can see that each one of them on their own are doing something amazing for the body and supporting and assisting you in managing your symptoms. Combine them together as a synergy of these three ingredients are what we know as the essential vitamin packed with flavonoids. So you can start to get the big picture of how powerful they are and how do they work. Okay. Didn't say, I'm going to say it manages sugars at 7 critical points. And I'm going to skim over this because there's a word in there that I didn't see, because when we start looking at these flavonoids of being able to manage at 7 critical points, that we start looking at, well, then it becomes something that is quite powerful, that it can support and assist the body's health. That wasn't very good. There are 7 points in which the body interact with the carbohydrates, and we need to modify the effects of these carbohydrates. So what does it mean with these 7 points? It means that from the moment that you take the flavonoids, at each particular station that it stops at, there's 7 different key things that the body will do to help you to process those refined carbohydrates and control your sugars that you're absorbing in your body. The flavonoids help with better sleep and energy, less joint pain, reduced cravings for sweet and carbohydrate foods. These flavonoids provide the daily dose to reset the metabolism. Within a week, you will see an improvement in our health. What does that look like? As I said to you before, I don't know. But I can guarantee you there's going to be some effect on you if you do decide to stay with it. We need to reduce our intake of carbohydrates and increase your proteins and fats. And it is possible to have a meal a day or even a day a week without carbohydrates. So if you can try and think about doing that, because when we do eat sugar, the part of the brain that lights up is the same part that lights up when people use cocaine. So if you can remember what I said to you about that sugar cycle and how much of an impact that it has on people, it's really important to understand why it's so important to try and bring these flavonoids into your diet. So real food has color and taste and can be eaten raw. So I want you to think about that. And even with the enzymes that we now have that we're utilizing as well, real food. We need to be able to eat raw food just like we did in the caveman diets in our grandparents' era. But when we start looking at rice, we can't eat rice. We need to cook rice. So then when it's a cooked food, our bodies were not designed to actually do that. So because our bodies do not have the enzymes to digest them, rice has no benefit to the body. So how do you tell if something is a good carbohydrate, is to ask if it can be eaten raw. And this is where these flavonoids are going to support the system to be able to help you process them more efficiently. We do need to eat your fruit, your eggs, and your nuts, and we cannot live without protein and fats, but we can live without carbohydrates. So just think that 1 in 5 people are actually carbohydrate sensitive. But balance the body. So manage your sugars, support your immune system, restore to normal. So homeostasis. Regulate inflammation and properly manage your sugar in your diet as nature intended. Who should take these flavonoids? Just like a vitamin, everybody. So whether it be from a mother that's pregnant through to the last day that you're on this earth, as you know. Even your pets can take these flavonoids. So, and there's been many great testimonials with different various pets, whether it be cats, dogs, horses. We even had one with a sheep recently, through to a monkey even. So anything that basically is a mammal can take these. So I want to say, which one do I need to take? Well, I'll probably kick back on that one, because when we start looking at, there are 2 types, and one of them has a lower percentage of quercetin, and I said to you, so they're for people that do have sugar instabilities within their body. So whether they are gestational diabetes, type 1 diabetes, type 2, people that are on a lot of medications or have a lot of health conditions, it is beneficial for them to start off on the flavonoid formula that has a lower percentage of quercetin in it, and that is the one that is controlling the sugars. And the reason being is because if you were to use the other formula, which is the maintenance one, the quercetin percentages in it are a lot higher. And if you're somebody that has sugar instabilities, it's going to really create a huge disruption. So this is where the difference between the 2 formulas, you need to understand who needs what. But firstly, when we look at it, these flavonoids, they do provide the essential nutrients. I want people to really understand. And the 2 formulas of the flavonoids, as I was mentioning to you, both manage sugar metabolism and they both manage inflammation. One is focusing on controlling sugar, the other is focusing on managing inflammation. Families of all ages, as I said, are safe to use these, from all ages right through, and your family pets as well. Everybody is different. So whilst we've got on the side of this product that you've got a suggested dose on there, think about that you may need to adjust this. So everybody is different. So these flavonoids are a vitamin, and it is safe to adjust your daily intake as needed, because it's a natural product that you're putting into your body. It's food that you're putting into there. So if you are navigating with a medical condition that's challenging you, or you know somebody that is, please consider adjusting your normal daily doses. It can assist and support reducing your inflammation and also the symptoms that you're experiencing. I had to think back about this from when I personally started this product. I did experience detoxing. I had a lot of conditions that were going on in my system, and I actually went through 3 quite intense detoxing periods. And interestingly enough, it happened literally every 3 to 4 months for me. And so what I needed to do was, as my body was healing itself with the support of these flavonoids, my body was changing and my symptoms changed too. So I needed to ensure that I was rehydrating with a lot of water to be able to help my body and fuel my body with quality choices to support my body as it rebalanced itself with these flavonoids. Science and technology, as I said, it's had over 15 years of research. It has human clinical studies and patents attached to it. There is a published extract on a particular product that Dr. Ahrens has had, which is this one here. As I said, the human studies were there, so you've got the clinical studies as well. Composition, so if we look at it, it's been patented. So we know that, and it's been patented for treating diabetes and also metabolic disorders. So let's finish this up and talk about allow your body to find balance and unwind the feelings of dis-ease. So not disease, but dis-ease, of where it's uncomfortable, and allow it the time that it needs, because it does take time. And I want you to think about how long you've been navigating with these symptoms, because this is going to unravel at a cellular level. I do guarantee you that. But as I said, how long that's going to take, I don't know. But what I do think you've got to ask yourself is, how long have I been dealing with this for? think we're pretty much finished. So last thing, as I said, invest time in your health before your health invests all your time. And I just want to thank you all for joining me today. And I hope presenting it in that way allows you a way of being able to share it with people and stay compliant, because you can see individually with those flavonoids exactly what they do bring to the table with the flavonoid formulas that we do have. So on behalf of Dr. Ahrens, I want to thank you all, and please stay on the call to please ask us some questions, and then we look forward to seeing you next week. So thank you so much.